Welcome, everybody. This is At the Table with CAHSAH, presented by California Association for Health Services at Home, with support from Heffernan Insurance Brokers. Heffernan Insurance is proud to support home-based care providers across California, helping agencies protect what they've built and navigate today's increasingly complex healthcare environment. You can check them out at Heffins, that's HEFFINS.com, Heffins.com. My name is Mark Wilson, and every week on this podcast, we bring you real conversations about important policy issues that CAHSAH is moving on right now, and also some practical strategies that are shaping home care across California, and of course, some very interesting people. Speaking of which, we have three terrific CAHSAH professionals here today joining us on this first ever podcast. So in no particular order, Director of Membership, Tricia Smith, Director of Policy, Advocacy, and Public Affairs, Tanya Batista, and Sua Vang, CAHSAH's new CEO. Certainly not new to CAHSAH. She's been around for a while, but a brand new CEO in the last 4 or 5 months. So, and I want to start with Sua, actually. By the way, hi, everybody. So glad to see you.
Hi. Great to be here.
Sua, let's talk about, if we could, please. I know the goals for CAHSAH this year, part of it is more engagement with membership. I wonder if you'd take a moment just to talk about how this podcast fits into your overall vision going forward.
Yes. So when we were coming up with ideas on how we can encourage more engagement with members, we were very excited that we could use this podcast platform as a means for us to communicate with our members, for us to be able to have conversations about policy and legislation, and then also have a platform for us to discuss issues that are keeping up home care leaders at night. So this fits in right with all of our strategic plans. That is to enhance our voices at the Capitol, educate our members, and engage with our members much more.
Okay. I wonder, and here's what's kind of cool about this podcast idea, I think. We're going to make it about 30 minutes long, 20 to 30 minutes long. So it's something that people can easily consume, right? And that was part of the whole process. We want people to be able to get the information that you're going to put out there. And the information is really stuff that's happening in real time. So when we talk about policies on this podcast, it's stuff that, Tanya's been working on or you've been working on. And I think that's what makes it kind of cool, is that it's easy to consume and in real time. I wonder if you could share some of the things, since you're the new CEO, some of the things you'd like to accomplish in the next, let's say, 12 months.
Yeah. So I feel like CAHSAH has had a great base coming into this organization. I mean, CAHSAH has been around for 60 years. In fact, this is our 60th anniversary, so that's really exciting to know that we have been serving our licensed home care, home health, and hospice providers for 60 years. We've been the voice for the industry. And for me particularly, what I would like to see is I would like us to be able to be intentional in how we address the issues in this evolving landscape that our members are facing. I mean, recently in the national news, there's been a lot of talk around fraud and abuse. So that's a really hot topic right now. And I know that Tanya and I can dive more into it later. But really, our theme for this year is execution. And we want to make sure that CAHSAH is at the right place, at the right time, at the table, and ensure that home care, home health, and hospice voices are heard. So our theme this year is to ensure that home care is at the heart of healthcare. We are the center of it, and we want to make sure that the voices are elevated and that we are able to execute and ensure that any roadblocks or any issues that come about, we're intentionally addressing it and addressing it thoughtfully.
Uh, it seems to me that you're making a real attempt to bring membership more into the conversation and making yourselves and the organization more accessible to them. I know you guys just came off a world tour. Hey, right? You did a lunch and learn in 3 different cities, and you've got more of those kind of things planned. And obviously it gives people an opportunity to get with you face to face, have a conversation, a two-way conversation, and really share with you some of the things that they're concerned about on a day-to-day basis. Because we know that what happens in LA isn't necessarily what happens in Fresno, and the two markets. All these markets are completely different, even though they share some of the same concerns. So it seems as though you're really trying to take CAHSAH to membership as opposed to just sitting in Sacramento waiting around for things to happen.
Right. I mean, our office is based in Sacramento, but our membership is spread throughout California. And so when we did that tour, it was very interesting to hear how the different regions had different issues that were keeping them up at night. And that's one of the things that we were very intentional about was, yes, we want to tell you what we're doing for you, but we also want to listen. And that was the point of that listening tour, was that we want to listen more than we're talking at this point, because we want to ensure that we're not shooting in the dark and that we are hearing what the members are wanting to see their organization do for them.
I think like Sue, I don't mean to jump in, but I think like Sue said, execution is important. I think we listen to them. We have our lists from what they brought up to us at each of the areas. And I think we're getting back out there via a virtual opportunity so others can participate, but also to be able to share our follow-up from what we listened to and their issues were in regards to what was keeping them up at night in the different areas. So I think what's exciting about kind of what we're doing now is the level of engagement is hands-on, grassroots. We're, like Sue said, we're not in Sacramento just talking to members. I'm down on the Central Coast, and my goal is to be out there meeting everyone. I had our first membership committee meeting last week, and it was really exciting. Tanya got to participate in that too. I'll be going to their regional council meetings. I'll be listening, on location, if you will. And that's exciting because we get to hear the stories from our members on everything that they're accomplishing and working with too, because there's a lot of good things going on despite a lot of the stuff in the news too.
Well, if I could just say, this podcast, I think, will be, again, you hear things on a day-to-day basis in the various places that you are, and then we're able to talk about them in this weekly podcast so that people can actually find out what CAHSAH is doing about the very conversations and the very things that they were talking to you about in these sessions. So let me, there's a lot of stuff. Can we even have a conversation without talking about hospice fraud in California right now? I mean, it's hard not to, but at the same time, and correct me if I'm wrong, you don't want the hospice fraud stuff to overshadow the many good things that CAHSAH is working on right now at the legislative level. Tanya, do you want to maybe tackle that?
Yeah, absolutely. I mean, I do want to caveat, though, that it really isn't just hospice fraud. When we are talking about what's going on, especially at the federal level, this does bring in our home health providers. CAHSAH is cognizant of how this is going to affect our members across the board, not just, that the headlines are speaking to hospice. When you have to really dive into the policy behind this. What is it that they're specifically addressing in practice and operation? This does have, a larger impact. And when we look at, the actual operationalization that they are, diving into, this does have implications for legitimate providers that we are very concerned about. So we're very active with many of our partners at the national level and trying to see what are the reasonable approaches to program integrity practices that can get into prevention, not just enforcement, right? Because that's downstream. That's when fraud's already happened. How are, we getting into like just prosecution? We want to get more into upstream prevention practices. That's what a lot of this is about right now. And we understand that. We want to be able to stop fraud from even entering the system to begin with. And that's something that we do all agree there's a zero tolerance for. How can we address that at the state level with licensure? How can we address that at the federal level with certification? But at the same time, how are we protecting our legitimate providers who not only are operating really well and providing these fantastic services to families and the patients in need, but are actually very proactive in reporting fraud at the same time. I mean, they are there on the ground in the communities, seeing it firsthand, and they are reporting it. So we know that they are as big of advocates as we are, at the Capitol and with the state agencies. So this is something that we're taking very seriously. That when we see so much of what's being discussed in the news and what's being issued, when we hear the concept of a moratorium being pushed out there, which would be a blanket concept practice where everyone's like just hard stop for everybody, in certain practices across the state. That's very deeply concerning, and we also look at it through the sense of like if there's a federal moratorium for hospices, especially, there's statute that would then institute a telehealth prevention as well. So they would have to stop telehealth in addition to all
And
these
and
licensure
that's
operations.
huge. I mean, if you're looking at rural or areas with minimal access,
Yeah.
that is
Yeah.
going to affect the care and service to patients in our state and other states too if it's federal. I mean, it's not tackling the true issue, in my opinion. It's
Hmm.
it's a broad stroke, as Tanya said, and that's going to have a negative impact for the people we serve.
Is there still a big pushback on telehealth? I know there used to be years ago that people kind of looked at. I remember somebody in some senator's office saying, you know what, we just look at telehealth as another opportunity for fraud and abuse. And it's like, why are you throwing the baby out with the bathwater? I mean, of course, there are going to be people in certain areas that abuse telehealth, but by and large, it's a very positive thing. Is there still that pushback?
Yeah, I think pushback. But I will say that one thing we want to be cognizant of, and we are as the CASA group, is that there's an overwhelmingly majority of our members who are serving the community with integrity.
Hmm.
And
Of course.
we want to ensure that if we are looking at this, Medicare, hospice and home health fraud, that we are intentional in how we come up with, guardrails to ensure that we're able to identify the bad actors
But,
and
but
get them out of the
Yeah,
system.
but Sue, can I ask you this? And how do you do that? How do you execute on that? I mean, if you find a bad actor, what is CASA able to do at that point?
Well, I mean, for us, I think that we would work with CMS and Department of Healthcare Services to ensure that we're following the protocols to call out bad actors. Really, though, I think it's identifying the source, right? Where are the regulatory gaps that they're able to come in and be able to take advantage of that? And how can we stop that bleed? Because we definitely don't want to create some moratorium or ask for a moratorium that is going to um, unintentionally create consequences that is going to hold our members who are operating with integrity to stop giving care. We already have a workforce shortage. It's already something that members are facing that is prohibiting them from being able to serve all of the members that need care at home. So we need to be very careful and very intentional in how we go about addressing it. So I would say if we see bad actors, and that doesn't just go for CASA, but it includes all providers and members, if you see it, report it. Because the more
Right.
that we see and the more we're able to identify, then we're able to uh, find solutions, create stronger guardrails to ensure that bad actors aren't continuing to take advantage of the Medicare system.
And those bad actors continue to make it more difficult for the ones with integrity to operate. It adds more administrative burden onto them to do it the right way. And with the workforce shortages, you have new nurses coming in who maybe they wouldn't necessarily have hired previously, but because of the lack of nurses, we've got new nurses coming in without the experience and education that need more focused education. Those cost more too. That's adding additional expense and potentially doing the right thing. But the documentation piece, if they're not educated right, then that creates a risk for legitimate providers too that are trying to do the right thing. I just think that we've heard from members that what are they going to do about it? We've reported it, but what are they going to do about it without it impacting everybody else that's trying to do a good job?
CAHSAH is part of the solution. Like we're not just saying, oh, our members aren't committing fraud, so we're not the issue. Just leave us alone. Like we are actively part of engaging in the systems, in the solutions. We're at the table with the Department of Healthcare Services. We're at the table with the public health. We're talking with them directly on where can improvements be made to address prevention practices, to address where can enforcement be strengthened across the state and you know in the hot spots, and where can risk assessments be improved so that way we can operate, you know, with
Yeah.
full disclosure, um, with the accountability that the public expects of us.
If you could say, okay, here are top 3 to 5 priorities for CAHSAH right now. What are we working on um, right now that's going to matter to any CAHSAH member or anybody in home-based care?
Yeah, absolutely. I can start with that. I mean, you know, we're going into the legislative session, and that certainly allows us opportunity to really hone in on our priorities for our members. Private duty nursing, looking at the rates for our home health agencies, that's always going to be a priority, making sure that from a workforce standpoint, we can stay competitive, we can bring in the talent, and you know, ensuring those rates are competitive is going to always be a priority for us. So we do have legislation on the table addressing that. That's Assembly Bill 2240. So we're really excited to be championing that bill.
Is that something that CAHSAH sponsored?
Mhm. Yep.
Awesome.
And then from there, we're also looking at Assembly Bill 2081, which is addressing the home and community-based alternative waivers, increasing access to the waivers, which is a huge need across the state, of course. But you know, to open up new spots and double that access would be a major priority, is a major priority for CAHSAH as well. And anything home and community-based services is something that we want to keep at the forefront of our priorities and what we support with for the state. So, Sue, would you add anything else to that?
I would just say that we are working on several bills. As Tanya said, we have one that we sponsored, another that we're supporting. And of course, you know, with some of the other issues that our members are facing, we're continuing to look at ways for us to look at policies and regulations that can help them. But I will say that education is a huge part in how we can ensure that our members are successful. As you see that the media and you know everybody's coming down on fraud and abuse, we want to make a big distinction between actual intentional fraud and errors. And so education is such an important part. And in fact, last week we just had our manager certificate training programs, and many, many leaders and emerging leaders came to this program in Las Vegas to really hone in on their skills and to ensure that they are doing everything correctly. So these errors are
Yeah.
fraud. No, there's a big difference between fraud, where it's intentional, and errors. And the best way to ensure that your organization is in good standing is that everybody is in the right place, on the right seat in the bus, and they are doing what they're supposed to be doing, and that they know what they're doing.
Such an important point. Such an important point. It may not be fraud. It may just be a mistake. And the more education you have, the less likely you are to make mistakes. Wow. Let me just take this minute right here, or the 30 seconds anyway. We'll get right back to the conversation in just a minute. But I want to take a moment to thank our sponsor, Heffernan Insurance. Heffernan works closely with home care providers throughout California. Many of you know them, helping agencies manage risk, protect their organizations, and operate with confidence in a changing healthcare landscape. You can check them out at Heffins, HEFFINS.com. And their partnership with CAHSAH, by the way, helps make conversations like this one possible. And if you don't know this already, their pizza parties at the annual conference are legendary. And I'm told that this next one, because it's the 60th anniversary of CAHSAH, is going to be stellar. So let's take a minute, not a commercial or anything, but I know we've got some things planned for the 60th anniversary. And one of those things is we're on a mission to get a minimum of 60 new members in 60 days. Tricia, you're sort of leading that effort. So you want to talk about that for a minute?
Yes. Along with our 60 members in 60 days, we just launched our new dues structure, which goes into effect April 1st. And that has been something that the board has been working on since before the end of last year. And it's been one of their priorities. And I'm happy to say that we've executed on that and have moved that forward. And right now we're talking with members how it impacts them, showing them the value, how it improves. It's more of a best practice structure from what we had before, and really aligns it in a more equitable way for our members based on their size and type. So we're excited about that. And along with that is our push to grow, our push to become one voice. And the more voices we have, the stronger we are. And that comes from our membership. And so 60 days, we have 60 days to get 60 new members. We are going to empower our existing membership to be part of that goal too, which could be discounts at conference attendance, and then culminate at our conference for really acknowledging our new members, showing them what the true value of CAHSAH really is, which we can talk about all the time, but unless they experience it, they really aren't going to feel it. And I think our 60th anniversary conference this year is going to be the opportunity to do that. We are launching our new approach to our membership, which is incorporating CAHSAH's core values. Our mission is bringing CAHSAH to the heart of healthcare. And our core values with that are the acronym LIFT: leadership, innovation, fun, and teamwork. And we're doing our recruitment efforts and creating value for our membership using those core values as well. So we have our leadership and advocacy, our innovation with education and workshops, our fun in trying to make the fulfillment of their professional growth and education experience fun, and our teamwork. We have a statewide network when you become a member. If you've got an issue and you don't want to reach out to a competitor, you don't have that relationship yet, call one of our Northern Californias if you're in Southern California and say, hey, we don't compete. What are you doing with this? A huge opportunity to collaborate. And again, it brings a stronger voice to what we're trying to accomplish for our members, which at the end of the day is who they serve, which is our patients and our community.
Yeah, awesome. And I got to say, CAHSAH is a lot of fun too. And I think it's important to recognize that, well, there's a lot of fun that happens, because I think some people, if you don't mind me saying, I'm an outsider, so I can say this. You go to the conference. I've been to many conferences, and the conferences are so much fun. They really are. And I think it's important to know that CAHSAH is not just a conference or a couple of conferences or a couple of education sessions. There's stuff going on every single day. The team is advocating for home-based care in Sacramento and all over the state and nationally as well on a day-to-day basis. And I am as someone who's been in healthcare for about 12 years myself. I am very happy to hear that CAHSAH is extending the engagement, that it's doing the execution part of it. I think it's good to hear.
One of the things that came up on our membership committee call last week was Tanya attends an excessive amount of meetings. I mean, she is in every state agency meeting. Some of them
Right.
are specific to just their commitment with CAHSAH, which is something to be said about our organization too. But one of the points that were made by one of the committee members was, unless you're on that committee, that they're talking, no one else knows it. And so that's one of the things that we're trying to then actually share so that everyone knows. And this podcast is one way of being able to do that. We're revamping our website to create
Yes.
opportunities as well. So if they're curious of what's going on certain things, it's going to be easier to find. And then our open door or open phone policies where they can call and reach out to anybody if they have a question on anything or a concern. And I think that's great. But I mean, the amount of work that goes on behind the scenes, even when I was a provider, I didn't realize as much, even though I had been on the board and all of that, until I when Tanya speaks about the stuff that she's meeting on and doing and all of this, it's amazing. And I'm really proud to be part of this group.
Do you know what we should do? We should do a day in the life of Tanya. Get a camera and just follow her around all day long. You're knocking on doors, bugging politicians, walking down the halls of the state capitol. That would be fun, don't you think?
That would
You
be
called me a
exciting.
policy nerd last time, Mark. I don't know. Would that?
Well, you kind of are.
I
You
mean, as long
admit it.
as you're like, oh yeah, no, I love it. I was just listening to a hearing earlier, and I emailed Sue how exciting it was for me, and she's probably like, that doesn't sound exciting at all. But I thought it
Well,
was great.
you all have your own roles. I know that. So, at any rate, we're about 30 minutes in, so we're right on time. Let's end it there for this podcast. I want to thank everyone for joining us today and sharing their insight and perspective. CEO Sue Vang, Tanya Batista, and Tricia Smith. And thanks to all of you for listening and for the work that you do every day to care for patients and families across California. And thank you again to our presenting sponsor, Heffernan Insurance, for their leadership and support of California's home care community. And make sure you check them out at our annual conference in May. What's the date on that again?
June 22nd through the
June.
25th.
It used to be in May, but it's end of June now.
Yeah, it was always on my birthday, so which made it extra special.
Yeah, well, we wanted you to have your birthday, by itself, and so we decided to
Thank
move
you
the
very
date.
much, Sue.
Well, I don't mean by yourself, but
I know.
It deserves its
Special.
own day.
Yeah.
Yes,
Exactly. Well, anyway, check out Heffernan Insurance, and thank you to them. I'm Mark Wilson, and this has been At the Table with CAHSAH. And remember, this is your seat at the table, and we'll see you next time.